Hi, I'm Dr. Alvin. Today, we're going to talk about gallbladder stones. First and foremost, I would like to apologize to all my subscribers since it has only been now that I made time to create another video for all of you. So today is going to be quite a longer video than expected because I'll try to epitomize everything in just a couple of minutes, because today we're going to talk about cholelithiasis or gallbladder stones. So stay put, relax, grab your coffee, and stay tuned. So before I start with our topic, let me first give a run-through on what is to be expected in this video. First, we're going to define what are gallbladder stones, or what is cholelithiasis, what are the most common types of stones, what are the risk factors involved, what are the signs and symptoms, what are the signs and symptoms that you will experience whenever you're suffering with gallbladder stones, diagnostic procedures that should be done in order for a physician to determine whether you are suffering from gallbladder stones, and of course, the treatment. So these are the 6 topics that we're going to discuss. Let's first define what gallbladder stones are. Gallbladder stones are a collection of solid material that forms inside the gallbladder. Okay? So what are the components of the gallbladder stones? The main component of the gallbladder stone are bile salts and acids, which is comprised of 70% of the gallbladder stones. The rest are cholesterol, which is composed of 10% of the gallbladder stones, a phospholipid, which is mainly lecithin, 5%, proteins, which is also 5%, 1% of bilirubin, and the rest is simply bicarbonates, water, and electrolytes. Okay? Let's just keep on pushing this one. So the next one is, what are the types, or what are the most common types of stones? Number 1 is the cholesterol stone, which is composed of 75 to 90% of patients suffering with gallbladder stones. The next type, or the next most common type of stone, is the bilirubin stones. The bilirubin stones are also known as the pigmented stones. And these are the stones which combines with calcium. That's the reason why, in some instances, whenever we do abdominal X-ray into some patients, we can see these stones through X-ray. The third most common stone is the brown stones, or this brown stones rather is because of a sign of infection. That's why the stones become color brown. So what are the species which commonly causes the brown stones, or the brown pigmented stones? They are E. coli, or Escherichia coli, the Clonorchis sinensis, which are the liver flukes, and of course, there's also the Ascaris lumbricoides. Let us now discuss the risk factors in having gallbladder stones. So basically, there are 5 risk factors. The first one, females suffer more compared to male in having gallbladder stones. Why is this so? It's simply because that females are linked to estrogen production of women, and in turn increases the cholesterol formation. The other one is being fertile. Fertile, it's also because of the use of oral contraceptives. Fat is a third one, or obesity, which is often associated with increased cholesterol, thereby an increase in the risk for cholesterol stones. And the last is, second to the last rather, is 40s. So those who are in the age of 40s and above have the higher risk factor for suffering with gallbladder stones. I can still remember these 4 F's during medical school, no? Female, fat, fertile, and 40s. The last one, and the other important thing, or the other important risk factor, especially those who are having intermittent feeding or intermittent diet, is a rapid weight loss. That's the 5th. Again, rapid weight loss. Why is that so? Because the decrease in lipids can create an imbalance in bile competition that in turn increases bile stone formation. So be careful, especially those who are doing intermittent fasting or intermittent feeding. Next, we're going to talk about the signs and symptoms that the patients suffer with gallbladder stones. Basically, there are 5 signs and symptoms. Number 1, it's the right upper quadrant pain. I'm going to show a picture here to show I'm going to show a picture of the abdomen to show where the right upper quadrant is. All right, basically it's just below the rib, in the right lower rib part. That's the liver is located here. The liver edge can be palpated just below your right lower rib. So this area, I don't know if you can see it, it's here, is our right upper quadrant area. The next is epigastric pain. This epigastric pain can also radiate to the back or to the right shoulder. Epigastric pain, or the pain, is located here wherein both the rib cage meets, connecting to the manubrium. You can actually feel something here, a palpable mass in this area, because that is a xiphoid process. It's a part of the manubrium. Where it meets is the epigastric area. Okay. The third one is abdominal bloatedness. Fourth, fever if you have an infection. Remember the other type of stone that is because of an infection. Fifth, the problem is, for the 5th sign and symptom, is if there is an obstruction. If you have an obstruction, you will be experiencing light-colored stools, dark-colored urine, and in extreme cases, you'll see jaundice. Jaundice is like you'll turn into yellow, or perhaps the sclera, or the white portion of your eyes, will also turn into a yellow color. Okay? So let's now discuss the pathophysiology of gallbladder stones. So first and foremost, the pathophysiology of gallbladder stones is because of the oversecretion of cholesterol by the liver cells and the hypomotility, or impaired emptying of the gallbladder. If that's so, therefore there will be more production of gallbladder stones. I'm going to show here a picture just beside me of the gallbladder stones. From the liver, one of the functions of the liver is to produce bile. After the bile is produced, it will now go to the gallbladder. The gallbladder then functions, as you can see here on my left side, the gallbladder functions as a storage of bile. The question is, what is this bile for? bile functions as emulsification of fats. So remember, every time we eat oily foods, fatty foods, this fried foods, anything with fat, after passing the stomach, going to the second part of the duodenum, where the opening of the ampulla of water is, the gallbladder will contract and secrete bile, passing the common bile duct, exiting the ampulla of water, going to the duodenum or the intestine, where it will emulsify fat for metabolism and subsequently for the absorption in our body. So, an example here is you're suffering already with gallbladder stones, and then you went to Jollibee, for example, or, sorry, am I allowed to use that example? Yeah, just an example, right? So you had a chicken joy, or a fried chicken for that matter, and then you start eating that fried chicken with the skin on it. After it passes the stomach, as you can see here in our illustration, it goes to the intestines. The bile will continuously contract and the gallbladder rather will continuously contract and secrete bile. Is that clear? Okay, just imagine I place a stone in your hand and try crushing the stone. How would you feel? It's painful, correct? That's the same thing that happens to our gallbladder every time we eat fatty foods and oily foods. I hope that is clear. Now, we're going to talk about diagnostic procedures in determining gallbladder stones. I'm just going to give you 4 types of tests. So the most common that doctors do to patients whom we think of as having or suffering from gallbladder stones is the ultrasound. Having an whole abdominal ultrasound. This is the most common study use. It is safe, primarily because it is safe, it is painless, and non-invasive. The ultrasound is with the use of high-frequency sound waves, and it has no radiation. Okay, so it is the most common study used in determining gallbladder stones. The second one is HIDA or HIDA. What does HIDA mean? HIDA is the Hepatobiliary Iminoacetic acid scan. Okay? Hepatobiliary Iminoacetic acid scan. It is an imaging procedure that helps track the production and flow of bile from your liver to your small intestine. It is also safe, painless, and non-invasive. However, the HIDA uses radioactive chemicals. So, it depends on your doctor. And it depends on the signs and symptoms, actually. Other tests are MRCP, which we commonly hear amongst our doctors, and ERCP. MRCP, which is the magnetic resonance cholangiopancreatography, or the ERCP, which is the endoscopic retrograde cholangiopancreatography. Okay? So these are the 4 tests or common tests usually used in determining gallbladder stones. Toward the end of the topic, again, let's go back to those which we have discussed already. So, we have defined what gallbladder stones are, what are the most common types of stones, what are the risk factors of having gallbladder stones, the signs and symptoms the patient can suffer with gallbladder stones, the pathophysiology of cholelithiasis or gallbladder stones, the most common or the diagnostic procedures used in determining the gallbladder stones. So finally, now we're going to discuss the treatment of gallbladder stones. All right, we're also going to touch some topics which I commonly hear from some of my patients, of which they have been asking me. First, the first question as to treatment is that, is there a medicine to dissolve the gallbladder stones? Correct? That's the most common question. Doctor, is there a stone that can dissolve, is there a medication that I can take to dissolve the stones of the gallbladder? It's because, well, who would wish to undergo surgery, right? So basically that's the most question. Well, there is a medication. It's ursodeoxycholic acid. The ursodeoxycholic acid is commonly used in my country, in the Philippines, which is given to patients with gallbladder stones. It is an epimer of chenodeoxycholic acid. It is commonly given by doctors, as I have said, in my country, which is also given as expected to do its action in dissolving gallbladder stones. However, based on my experience, I'm sorry, but the results were noted to be the same. Well, the ursodeoxycholic acid works by reducing the amount of cholesterol released by your liver and by slowly dispersing the cholesterol. This breaks up the stones. So, in some cases, well, you can see me doing the face again, because I have had patients wherein they have taken this medication and in return they still ended up doing the surgery. Sorry, guys. All right. Well, at least the question is answered. There's nothing wrong if you're going to try it, but it's still up to you. No? You can discuss this thing with your doctor. The other treatment, the second one, is something that I heard about from one of my patients, and this is called gallbladder flushing. Gallbladder flushing is by the use of apple juice, apple cider, olive oil, and Epsom salts. It is said that whenever they take these substances, the stones will be flushed out, passing the common bile duct. Remember that picture. From the gallbladder going to the common bile duct, to the ampulla of Vater, that opening to the intestine is called the ampulla of Vater. And then until it will go into our intestine and be removed through defecation. Well, my personal opinion in this is that the first question is, what is the size of the stone? Well, the size of the stone is measured through ultrasound. If the stone size is small enough that can pass through the diameter of the common bile duct, whether or not you will do gallbladder flushing, have these substances like, as I have mentioned, apple cider, olive oil, the Epsom salt, the apple juice. Without these substances, the stone can easily pass through. Just imagine your gallbladder with multiple stones with a size of, say, 2 millimeters. So every time you eat fatty foods, again, it will continue to contract to pour out bile for the emulsification of the fats that we've eaten. So if the bile is in liquid form, and if these small stones can go with it, even without the flushing, it definitely can happen. So On my personal opinion, I would rather not advise gallbladder flashing. Based on the book, of course, we always have to have scientific approach on this, no? Science-based fact. So, well, the treatment for gallbladder stones is surgery. Yes, sir, it's surgery. Because if we're not going to remove the gallbladder stones, you will continue to suffer epigastric pain, right upper quadrant pain, all the signs and symptoms that I have mentioned. Well, before I go to the types of surgery that can be done, there are two indications. Let us remember this. There are two indications for persons with gallbladder stones to undergo surgery. What are they? The first indication is if the stone blocks at the neck of the gallbladder. I will show this picture again. The neck of the gallbladder is somewhere there where you can see the blockage of the stone. That's called the neck of the gallbladder. I'll show an arrow so that you can see specifically where the neck is at. So that's the first indication. If the stone blocks at the neck of the gallbladder will continue to contract and secrete bile without knowing that there is a blockage already. So again, go back to the example I gave you earlier, wherein you have to place a stone in the palms of your hand and try crushing the stones repetitively. So it's going to be painful. The same thing happens to your gallbladder. Okay, so that's the first indication. The second indication for anybody, for a person to undergo surgery with gallbladder stone, is if the patient is already symptomatic. Okay, what does symptomatic mean? Symptomatic meaning you already have the signs and symptoms and it happens to you every day. I can still remember again during med school, we were asked how to describe the pain or the feeling of a patient suffering with gallbladder stones. It's called wax and wane. Sometimes it's there, sometimes it's not. Sometimes it's there, sometimes it's not. On the other hand, if it's always there to an extent that after having that bite from a fried chicken, a fried fish, any fatty food or oily food for that matter, and then you experience that excruciating pain in your right upper quadrant area, along with vomiting or nausea, the feeling of vomiting, and you experience this every day already, then that is the time for you to undergo surgery. Okay? These are the two indications for you to undergo surgery. Remember that. There are two types of surgery. The most common type is the open cholecystectomy, wherein you will be sliced open. An excision will be done. Well, it's called an excision. An excision will be done just below, just at the right upper quadrant area. And the other one is laparoscopic cholecystectomy, which is commonly done here in Qatar. The laparoscopic cholecystectomy, with laparoscopic cholecystectomy, I'm sorry, there is no incision. Instead, there will be a camera inserted into your body and other holes for the instruments to pass through. All right. So that's it. I'm stuttering already. I'm sorry. So I hope, guys, you learned something from me again. Thank you so much for the support, for watching my videos. I promise that I'll continue to produce more videos for you guys to learn from me and share stories as well. I hope you enjoyed watching. And continue to be safe. Always wash your hands. and God bless.